So hello everyone, my name is Norman Vincent Uy, and our next topic is about ketosis. So what is ketosis? Ketosis is a method of metabolism process, and when the body does not have enough glucose for energy, it burns stored fats instead. This leads to a growth of acid known as ketones. So we have three ketone bodies: acetone, acetoacetate, and 2-hydroxybutyric acid. Ketone bodies are reserve fuel for energy production in the body, especially for the brain. In normal state, we have carbohydrates, proteins, and fats to produce energy as a source of energy. But what if the three are lacking? So in starved state, body don't get calorific as input externally. In that state, our body will rely on its glycogen reserve. But what if all reserve is gone? That's the time ketosis takes place. Under the starved state, our brain needs to continue working and it needs energy. But the problem is that even the body tried to break down the fatty acid to produce energy, but the body cannot utilize circulating fatty acid and it cannot go pass through the BBB or blood-brain barriers. So the brain or the body needs to find a source that can penetrate to the blood-brain barriers, and it is the ketone bodies. So ketone bodies are produced in the liver that is channeled to the brain, and ketone bodies can easily cross BBB. And acetyl-CoA is one of the most important substance which can be utilized and produce energy. Without it, the cycle cannot push through. So in order to have that acetyl-CoA, we'll study how it is synthesized. So ketone bodies are synthesized in the liver, and 2-acetyl-CoA is converted to acetoacetyl-CoA and is converted to methylglutaryl-CoA and is converted to acetoacetate that can produce acetone and B-hydroxybutyrate. This is converted by the help of these enzymes. So next is in the brain, um, B-hydroxybutyrate is converted to acetoacetate by the help of B-ketoacyl-CoA transferase and is converted again to acetoacetyl-CoA that can by the help of thiolase it is converted to acetyl-CoA, and now we have acetyl-CoA that and the cycle can now continue and can produce energy. So what we learn here is that glucose is very important in our body because our brain is designed to metabolize glucose 99% of our life. So, and that ketone bodies are a good source of energy, especially in the fasted state, because in reserve, it serves as an energy backup fuel when carbohydrates are limited. Thank you.
In addition to ketosis, let us all talk about the keto diet. So, ketosis is a popular low carb weight loss program, and it also helps us burn fat, makes us feel less hungry, and lastly, it helps us keep our muscles. The next one is the health benefits of ketosis. So, ketosis can have some benefits beyond weight loss, and some research also suggests that ketogenic diet might help lower risk lower the risk of heart disease. And other studies show that specific diets with very low in carbs help people who have diseases such as the first one is the metabolic syndrome, insulin resistance, type 2 diabetes, acne, cancer, PCOS or polycystic ovary syndrome, and the last one is the nervous system diseases such as Alzheimer's, Parkinson's, and the Lou Gehrig's disease. And for the last part of our report, let's talk about the symptoms of ketosis and its side effects. During the first week of a keto diet, we might start to feel bad, and this is what you call keto flu. But it isn't an official medical condition. It is just because of sugar and carbohydrate withdrawal, or it might be because of changes in our gut bacteria or some immune system reaction. And these are some symptoms or side effects: the headache, fatigue, brain fog, irritability, constipation, trouble sleeping, and dizziness. So there are also bad breath, which is known as ketosis breath. So these are some side effects that we might feel when we do the keto diet. That's all. Thank you.